Many often get confused between fillers and Botox, and these terms are mixed up. So in today's video, I will tell you the difference between fillers and botulinum toxin injections, most commonly or widely known as Botox. Hi, this is Dr. Priyanka Reddy, founder and chief dermatologist at DNA's Clinic and Wellness Center. Let's get to the video. Well, primarily fillers and Botox are two very different treatments using different molecules. Now, fillers on one hand are done to enhance the facial contours or to restore the lost volume with age. While on the other hand, Botox is a treatment that is used to arrest the fine lines of wrinkles on the face. Well, so first about fillers. So fillers uses hyaluronic acid injections. These are injected on different parts of the face and even on some parts of the body like the hands and feet in order to make them look youthful. By injecting this hyaluronic acid in the desired places, one can achieve more defined contours and fullness of the face. Okay, some of the common concerns that can be addressed are hollowness of the temples that comes with age, under-eye hollows, liquid rhinoplasty, that is making your nose look sharper and slimmer by putting in hyaluronic acid filler. So this is a non-surgical option. So if you are somebody who wants to see how your nose looks after certain work has been done but do not want any permanent results, liquid rhinoplasty is for you. The other concerns being enhancing the lips, making the lips more fuller, or sometimes even if you don't want them to look too much plumped up or full, you can just do a little bit of filler to enhance the shape of your lips. The other indications being enhancement of the cheek area. If you have saggy cheek that is happening because of age, or naturally if it is not too full and you want a little bit fullness in the mid face, you can add fillers there. You can also treat the nasolabial lines that are coming with age by lifting up the tissues using the fillers. And one of my favorite areas to be injecting fillers is the chin. Doing subtle chin enhancement will lead to overall facial optimization and make one look slimmer. Along with this, you can also treat fine lines and wrinkles that happens on the forehead by using filler. Though this is not a very commonly done procedure, this is also a condition that you can address with fillers. And if you want a defined jawline that looks like a knife where you can cut melons, again fillers can do that job for you. Injecting fillers on this jawline area can make it look more sharper and well defined. You can also do hand rejuvenation, feet rejuvenation with fillers and reduce the appearance of fine lines and wrinkles on these areas as well. The other area being your decolletage. So when you have lots of lines on the chest area because of aging and collagen depletion, fillers can be done on this area as well in order to stretch the skin and make it look more youthful. So these are all the conditions that you can address with fillers. Now coming to the botulinum toxin injections, or Botox as one knows, this will help in temporarily arresting the movement of the muscle by paralyzing it. Don't get scared by the word paralyze. It is nothing scary. It is just temporarily arresting the movement of the muscle and nothing more than that. The results usually last anywhere between 3 to 5 months depending on the area that we are injecting and the units that have been used. So it's a super temporary result and nothing to be worried about. So what are the conditions you can address with Botox? All the fine lines and wrinkles that you have on the face can be addressed with botulinum toxin injections, starting from your forehead lines, the crossfade, that is the lines you get around the eye, especially when you make some movement like smiling. You can also treat the fine lines under the eyes by doing hyper diluted botulinum toxin injections. The other condition you can treat is gummy smile, that is when you smile, if your upper gums are seen, injecting few units of Botox into the muzzle can relax it and lower the upper lip. So when you smile, you don't see the gums anymore. And other conditions like wrinkling of the chin when you make some movement like this can also be treated with by injecting few units of Botox. Another amazing indication with botulinum toxin injections is the masseter Botox, that is if you have a broad jaw, that can also be narrowed down by injecting Botox into the muzzle here, so you can get much more slimmer looking face. Now the other indications which we treat Botox, which is not restricting to the fine lines of wrinkles, is addressing hyperhidrosis, that is if you have excessive sweating, we can also treat this with the help of Botox. Okay, so when can we get these procedures done? Are they safe? What are the side effects? What am I to expect after the procedures? Let's get to this. Now when can you start taking these procedures? Well, you can start taking them even in your early 20s if there is an indication for it. For example, if you have a deep line in the center of your eyebrows and you're using this muzzle a lot and you don't like how it looks, few units of Botox will help in solving this problem. Or if you're looking for fuller lips, fillers will help you in achieving that very safely. But always remember, when you're starting early, have a short-term vision but a long-term plan. Choose your injector or the doctor wisely. Always remember not to overfill. Do not get these procedures done way too frequently if you're starting early especially. Always try to grow minimum with the dosage and also listen to your injector when they ask you to stop getting it done. But otherwise, by and large, you start to get these procedures done when you see volume loss happening because of aging, or you start to observe declines on your face. So how frequently should you get these procedures done? Botulinum toxin injections last anywhere between 3 to 5 months depending on the dose and the area we're injecting. So if you wish to continue the results, you can get it done once in 5 to 6 months. And about fillers, depending on what type of filler we are using, the results can last anywhere between 9 months to 1.5 years. So if you wish to again have a consistent result, you can get these procedures done once a year, once in 2 years, depending on the area we are injecting and the product we are using. So what do you expect after the treatment? Well, botulinum toxin has no major downtime. The tiny injection pricks is what will be seen as little ant bites, and that will disappear in a couple of hours. With fillers, there can be a little bit of swelling that you can experience depending on number of syringes that you have gotten done in a single session and the areas that have been injected. Well, if you're doing a full face approach, yes, you might have a little bit of swelling, pain and tenderness for about 1 to 2 days. The doctor will be giving you anti-inflammatory or painkillers depending on the need. Sometimes a small bruise can happen, which will take about 5 to 7 days to come down. This is a possibility that can happen and one must be aware of, so that you don't place these procedures way too close to any major event that's happening. But guys, please do remember, as I mentioned, you must have a short-term vision, like how you want to look after the procedure, why you're getting these things done. So have that short-term vision, but always have a long-term plan, because if you like the results, which you definitely will, because these are wonderful procedures, if you're in the right hands, of course, you will want to get these things done repeatedly. So you must see how these things will pan out for you in the future as well. So never over inject, don't go over the board, don't be way too experimental in a single session, and always choose a board certified dermatologist or a plastic surgeon in order to get the best output. Well, the last topic is who should get these procedures done. Well, these are all only aesthetic procedures to enhance the way you look and you feel about yourself. So you get it done only if you want to get it done, and not because somebody else is asking you to do these procedures. So only you should decide what should be done to your body. If you have any more questions on this topic, please put them in the comments and I shall see you in the next video.